All right, everyone. Can everyone hear me okay? Now that I screamed it, sorry. We're going to go ahead and get started here. Welcome after the lunch session. Appreciate everybody making sure you're getting in here on time. That's great. Thank you very much. Next we've got the emerging fraud trends. And we're lucky enough to have a colleague and a good friend of mine, Sean O'Neill, to be able to present this today. I'm very excited to hear this. Sean's the Senior Tech Analyst for the Maryland Insurance Administration, supporting the fraud and enforcement. And I'm going to go ahead, since he's got a lot to cover, I'm going to go ahead and just kick it over to Sean so we can get started. So thank you, Sean. Please go ahead.
Appreciate you. Good. Can everybody hear me? Yes, up until about 16 minutes left in the Kansas City, I had some Kansas City jokes, and then they came back and won. So that's one. And then number two, I got to see the keynote speaker today, and then realized that I'm not an astronaut, and that he told a great story, and what a wonderful life that was. I wanted to just say, first of all, I really appreciate Greg here that welcome me back each year. Hopefully move that up a little bit. Third year, he's speaking to you, and if it's better, I can go over there. But I like to move around. I wanted to start off by just saying emerging fraud trends. I'm going to give you a little bit of a background. They're different from each state. Okay, so there's not one size fits all. You will see things differently, but I'll give you my take. But I figured first, it's kind of like, who's speaking to you today? So I always give like a little bit of 2 minutes as to who's speaking to you so you understand where I come from and a little bit about my background. So I'm the Senior Technical Analyst at the MIA. I actually support the Fraud and Enforcement Division, our Associate Commissioner here. There's a bunch of other MIA employees here today, so I thank them for coming. I am a retired, I'm a CPA first, licensed in Florida and also in Maryland. I got that in Maryland first. When I got transferred down to Florida, I got my Florida license. And the reason I did that is I retired as the FBI Supervisory Special Agent over the West Palm Beach office, which was in the news just yesterday. So I'm kind of glad that I'm on the other side of that. They're working really hard on that. My entire career, except for from little deviations in narcotics, terrorism, and organized crime, was actually in insurance fraud and white-collar crime. So I led the white-collar crime task force, and all I did was white-collar crime and public corruption. There's a couple things. I coach lacrosse, college lacrosse. I volunteer. I do a lot of recruiting for that. It's kind of like a side gig that I love. Yeah. I'll take that off. How's that? That's better. Awesome. I coach college lacrosse. I also am an average golfer. That is one big embellishment. I'm not an average golfer. I'm extremely below average. We all know, I can see by the looks on people's faces, they're right where I'm at. And instead of a van down by the river, I live on a small lake in the central of North Carolina. So life is very good. So when you think about emerging fraud trends, it's a little bit interesting. We see some things so many times that, sometimes some things are new, some things you saw from 20 years ago that somehow come back. So I figured I'd just do almost kind of like a top 10 list. And I was going to use David Letterman, but he's a lot funnier than I am, so I decided not to do that. So I got the graphics department to throw this up here, and I thought we'd start with some stuff. I'm going to concentrate on about 3 or 4, and then I'm also going to tell you what we're doing, and then a little bit about how some liaison resources, even with the FBI, since Rob and I are still involved, and Rob's a retired FBI Supervisory Special Agent too, what we're doing at the MIA to go ahead and combat the problem and do a force multiplier. So I call this the top 10 list. It's kind of funny. This is the rinse, wash, and repeat. I'm sure all of you sitting out here have seen this so many times. It's tough to watch, right? Workers' compensation and disability fraud, right? It's sitting there. We're doing something a little bit different. A couple things that we've noticed at the MIA. AI is great. You're going to hear me talk about that a little bit. when I used to look, even when I was with the Bureau and we used to review documents 10 years ago, and you would see, fraudulent invoices, fake records, things that were sent across, whether you got it better via, voluntary, federal grand jury subpoena, search warrant, okay? Some of them were clearly false. You could look at them real quickly, you could review them, and you could opine with a great deal of accuracy that they were false. Some of the AI-generated invoices and things of that sort have kind of come across where, boy, the information that they put out and then what is actually produced is essentially really amazing as far as how much that is. It's really fascinating how much, things that we need to go ahead and check. For this in particular, we've reached out to 2 federal agencies to go ahead and help us with that. Department of Labor on the workers' comp front, and then we have some preliminary discussions with OPM, Office of Personnel Management, OIG, on the disability front. They actually reached out to us, of all things, wanting us to help them. I mean, if you can imagine that, if they want us to help them, they're going to give us resources. Now, we have to combine a resource with them to go ahead and work those type of cases. They're down on resources, and I'm pretty sure if I saw a show of hands, essentially from this audience, how many of your agencies are kind of staffed light? It's probably a whole lot of this, right? I'd almost die if I said, hey, is anybody overstaffed here? Okay? Yeah, the chuckles. Maryland Insurance Administration is, we're common in we're understaffed. You have to do less with more. How do you do that? I'll kind of wrap that up at the end as kind of some takeaways. I'll also give you my contact information where I can help you, steer you in a couple of directions, because our liaison program is pretty robust. Next up, life insurance application fraud. We see an influx of that. I should probably step back. Every state has different amounts of referrals. Probably the MIA gets somewhere between 20 and 40 referrals a day. Not even just through the NAIC, not just through the NICB, but also through our portal, our website, our call-in lines, and things of that sort. Application fraud coming in, all of the records are fraudulently put forth. It's all misapplication fraud, okay? Requires you to get devil in the details. We take on those most egregious cases. I mean, as you can imagine, much like your own states, you have a limited amount of resources with the amount of referrals that you've come in. The actual, kind of meat and potatoes of the referrals are actually extremely well. They're very well written. They're very detailed. They give us a lot of information, more than enough to predicate either a preliminary investigation or an investigation on our side. And so those type of things is what to pick up at. We've seen a lot of application fraud for life insurance here. They go ahead and then we go ahead and then follow up on checking their previous conditions that they went ahead and lied on their application. It's not certainly a hot topic. That's why I threw it at the end, but it's just because of the influx that we're seeing from them right now. And then staged accidents. I really had the privilege before I retired from the FBI. We ran an undercover operation called Operation Sledgehammer, and it was staged accident fraud in Florida, taking on their PIP, their $10,000 no-fault insurance. We wound up convicting over 50, everywhere from runners. We actually convicted 2 patients that were so egregious that they kept putting their kids in the car. And because, $10,000 a person, $10,000 an accident, if you control both sides of the accident, it's a pretty good business model, right? It's $80,000 an accident. I just remember that. We did a search warrant. I'll just tell one side story. They kept a ledger. It looked like a Fortune 500 company on QuickBooks. Had revenue projections. How many stage accidents they were having, all led up to urgent care centers, chiropractic centers, and then 1 or 2 attorneys. Where are they falsifying that stuff? For this in particular, we rely heavily on 2 agencies, which is the FBI and the IRS Criminal Investigation Division. And we have a couple of those cases going on right now. I think it gives us a little bit more breadth. As a little bit of a side note to that, if you're going to participate in a case like that, and an FBI or IRS is going to take lead, just keep in the back of your mind, it is going to be a Rule 6E grand jury investigation. That means you're going to have to designate a couple of employees from your agency to go ahead and get sworn in, signed in as a Rule 6E. And federal grand jury is a secretive process, okay? So you can't just give the information out to everybody in the agency. It has to be to a couple selected few. What we usually recommended with the Bureau would be your investigator and essentially that investigator's supervisor, he or she, who she is, okay? So just remember that. But it's a great force multiplier. It's the ability to work these cases. And these cases, they sting a lot. You'll find that the breadth of these cases, they go, long ways. And usually you hit one, you hit two. The lead way down on a PIP fraud case usually ends pretty far down the line. It just depends how long you want to investigate and the resources that you have. It's almost like a well that you throw something down in. You're not sure whether it's 10 feet or 100 feet. Most of the time on a PIP case, it's usually 100 feet because it's literally that lucrative to a bad guy. And so I'm kind of taking that perspective when I speak to you here from today. I got a chance to interview so many defendants that I arrested, but it wasn't because I arrested them that I learned something. It was because of the hundreds of interviews that I conducted of them afterwards. And so they really provided me training on the job as to, one, the motive as to why they did it, and two, the mechanisms of how they were able to evade law enforcement, insurance regulators, and things of that sort before you get to that point. All of that together usually ends up for a couple multi-year investigation, but they're literally worthwhile. I want to talk about phase two. Let's look a little bit about slow and steady, right? Homeowners insurance, oh my gosh. Prices out the roof. We just heard from a speaker earlier, okay? When you look at homeowners, I wouldn't even want to see, I'm sure there's some folks here from Louisiana. I know that they just endured that the latest hurricane that went through there. Maryland's not immune to it. It's a little bit strange. We're not in Tornado Alley. We generally do not get hurricanes. Every once in a while we do. Do we have a massive roofing problem? Yes, with public adjusters. They come out of the woodwork. A lot of them are direct solicitations of homeowners knocking on their doors. Hey, your roof's damaged. We'll go up and take a look at it and we'll give you an assessment real quick. You guys have probably seen that movie before. I usually use the analogy, have you ever seen Rocky I? How many, come on, just a quick show of hands. How many people love that? It's a feel-good story, right? What do we know about Rocky I? There's a Rocky II, and a III, and a IV, and a V. Okay? So we've all seen that movie, right? Who gets up on the roof? They knock on the door. Mrs. Johnson is there. Hey, listen, you got roof damage. You don't need to get up on the roof. I'll get up on the roof. I'll use my ladder. I'm going to get up there. You may hear a little bit of banging or something. That's just me testing areas. Of course it is, right? The manual damage requires, for us in the insurance industry, got to hire engineers to go up there, do the review, costs us money. But, roofing, big money claims, we're trying to look heavily into that. That is one of our areas of focus, is actually roofing and public adjusters. So as you can imagine, that's a hot topic. I'm sure it is for you, specifically when there's like disasters and things of that going on. And we haven't had any of that. We've not had any major disasters in the last year and such. Go next. I want to spend a little bit of time on this. This one seems easy, but it hasn't been that easy for us. I would have put this almost close to number one for Maryland in many ways, but I'll explain it to you this way. And just appease me for a minute or two. So you have a title producer. It's a title company. Generally in Maryland, a lot of times they're owned and operated by a licensed attorney. Okay, and so you think of that and you say to yourself, in the retail side of the business, it's an A to B transaction. Okay, I come in, I'm going to actually buy a house, and I'm buying Greg Welker's house. We negotiate it for $200,000. They're going to prepare all the closing documents, the HUD ones. They're going to get written closing instructions, payoff instructions, whether he has a loan. they're going to prepare the HUD-1 settlement, and we're going to go to a closing date. Now we get a bunch of estimates. You say to yourself, well, geez, that's unbelievable. It's so easy, right? One-to-one transaction. I'm sure a lot of us have all closed on a house or two or something like that. In this case, what's hitting us, and we've thrown this out to some neighboring states, we've had an issue that deals all the way out to transnational funding going down through southern Florida, basically where I used to have my operations with the FBI. And I'll explain the scheme like this. You have investors that come in, and it's a couple-fold, almost sounds like a Ponzi scheme, but I'm going to submit to you it is a Ponzi scheme. They come in, they're going to buy distressed houses in Baltimore. They also do it in Philadelphia, and they buy houses that are essentially uninhabitable, okay? They buy them on tax sales. Taxes haven't been paid forever. They go ahead and buy a row home for $7,000. Why are they seeking? The first question that we had to ask in this process to what they called, instead of a flip transaction, they called it transactional funding. We learned real quickly that a lot of the funds were coming from foreign investors, Central and South America, non-English speaking, okay? And they were using, basically recruiters in Miami to go ahead and find them for can't lose investments, guaranteed returns. I would submit to you, we all sit here, we see what the stock market looks like. One day we're up, one day we're bad, right? Goes up and down. The promise goes further than that. They're not told a lot of various things. First of all, there are no closing instructions. There are multiple transactions before that transaction gets to them, and ultimately, many times a $7,000 distressed property is then sold to a foreign investor for $100,000. Nothing's been renovated, nothing's been remarketed, nothing's been done to the property. What is the catch? What they're trying to sell people, which is extremely important, is you go ahead and buy these houses. And what we're going to do is we're going to renovate them for you. As soon as we renovate them for you, we're going to give you a guaranteed income stream. The guaranteed income stream is going to come from Section 8 housing. So what do? Keep taking money, keep taking money, keep taking money, right? In our case, a couple of different cases. In one, they used 3 title insurers. That's why we're involved. The person that was conducting the transactions, that was the mastermind, actually lived in Pennsylvania and is a former CPA. Doesn't have his current license. He was the one funding the original transactions. 3 different title insurance companies were used in the fraudulent scheme. Where does it break down? Yes, sir.
I can't hear you very well.
Oh, I'll slide right there. Yes, sir. 3 different title insurers, okay, are utilized in the scam. He spread it out over 3, always for a reason, gave them certain segments of the transaction, okay? And so what starts happening? In the beginning, everybody's happy. People are getting paid their Section 8 rental income, except they think they are. Let's say it's $800 a month. And so I'm getting $800 a month every month, okay? At some point, one of the investors, out of the blue, figures, geez, I haven't been up there to Baltimore, okay? I should probably get somebody to lay eyes on some of my properties. This investor, who was a gentleman, had been receiving rental income for about 18 months. Now imagine reading, $800 a month for 18 months. You think you're getting exactly what you're talking about. He hires a private investigator. The private investigator goes down into Miami and takes photos of 4 of his properties. One of them's burned out, one of them's collapsed, and the other 2 are boarded up. At some point, you go, uh-oh, usually followed by SpaghettiO. Remember that as a kid? It's when you did something bad and you knew your grandmother was going to be mad at you, but you still knew she was going to give you ice cream on the back end because she loved you. He calls in to the MIA. and says this is impossible, which I would agree, it is impossible. How are you generating Section 8 income from a house that's uninhabitable that hasn't had a rental person in there? We started pulling all the transactions from the 3 separate title insurers. Our lane, of course, is licensure. The gentleman that was conducting the fraud, that's a fraud referral. We're looking at how they conducted the transactions. Think about this. Every time the transaction is done, there's only one deed filed. All the transactions that go from $7,000 and it goes from $35,000 to $75,000 to $100,000, none of the deeds are filed. There's no closing instructions. A lot of times it's verbal. It's one guy calling somebody else. Hey, Rob, this house is $100,000 going to this person. I mean, let that sink in for a second. Our 3 title insurers for that case, which are under investigation right now, and we're producing orders of revocation on those currently, violated a myriad of the insurance code. So with the MIA, we have the ability to revoke, we have the ability to fine, we have the ability to order restitution, and then the overarching case goes to that. I would submit to you, if you have a distressed area in your whatever state you're in, okay, you might want to be on the lookout for this. We thought this was the only case in an isolated incident, and then secondarily, we get a second case. Completely different people, almost exactly the same scam. And so our title insurers, we're going to hold them accountable. We'll make sure that it's a level playing field. I just want to put title producers on your radar screen. I think sometimes, I think they can be singular transactions where somebody may make an error or a mistake. These are not mistakes, because if you think about this, what a great business what happens when mortgage rates begin to rise? Market starts to cool off, right? All right? You're not getting that volume business, except on the investor side. Think about what's in it for the title companies. They might have 3 or 4 transactions for each property. They're taking fees for each one, except they're not recording the fees. Instant profit. Doesn't sound like a lot, right? If you only do it one time. What if you do it hundreds of times, right? Kind of covers the losses of a downturn in the economy. I wanted to throw that out there. It's kind of a hot topic issue right now. If you haven't seen it in some of those areas, I'm going to assume you're going to see that in one of those ways. If you do, at the end, when you see my contact information, I'm happy to share with you kind of what our investigative plan was and kind of how we went and did that. So please feel free to reach out for me. That's kind of why I'm here. We're going to get this going. There we go. We all love this, right? It hits, it keeps hitting. I would like to sit here and say that medical tourism came and went almost kind of like a good vacation. You know what I mean? We still are getting these cases where folks are coming in. It is another opportunity, and I want to throw this out to you. It's actually not an FBI-led initiative, but I can hook you up with people that we did. Department of Homeland Security, specifically Customs, has a document fraud unit. And if you write anything down regarding medical tourism, you want to write that down. You want them as a partner. If someone comes into the United States on some sort of visa program with the intent to defraud, it triggers certain things, including laws that they can enforce. So we had a lot that came in, and so we have a state-based health exchange, the Maryland Health Exchange. Okay, you have different policies. Some of them are catastrophic. All of them up to what they call the Cadillac plans. We've had ones that have come in, they hit the Cadillac plans, all of them sign up for the same plan. They've been on the ground less than 2 days. We're narrowing down the person that brought them. A lot of them were from, over in Europe, Eastern Bloc countries, things of that sort. And then immediately seeking care, a lot of them into mental health therapy, substance abuse elsewhere, even outside the state of Maryland, even though and then using a fake address in Maryland to go ahead and get the actual policy signed up. So immediately coming in and getting that Cadillac plan. I think it's something for you all sitting out there today. Take a look at it. If you remember anything I tell you based off of medical tourism, I would ask you, if not, reach out to your local DHS office, ask them for the special agent squad that's assigned to do document fraud for visas. They will know exactly what you're talking about. They will help you with these cases, okay? Kind of get through the cut and the mustard. All right, top 10. FaZe coming on strong. Oh, we love towing. Come on, show of hands. How many people love to get towed? Come on, one time it. Let me tell you something. I've never seen more shenanigans and fraud than I've seen in towing. We're getting like multiple complaints a day. We're concentrating the fraud. You can see that. I mean, and let me, there's a couple different things here. Both Rob and I worked corruption cases. Some of these folks are showing up to accident scenes probably before they should, and they weren't called by anybody. Ask a question, answer a question is what the Bureau teaches you, and lastly you go, I should maybe ask another question about that. That's a topic that's Greg's next topic I'm going to talk about. We're going to talk about corruption and fraud. So we started talking to people, and we see some of these on here, and we're like, the extra person fee. So a person gets into an accident, right, gets rear-ended. Okay, tow truck automatically shows right up. Person standing outside, maybe they're a little bit achy. Car drives by. I can't make this up. Hey, Greg, I'm with the tow company. All right, keeps driving off. They charge an extra person fee. We're concentrating on that. That is not the way it's supposed to work. If you need an additional person to help with a tow, it's to help with a tow. It's not to drive by and wave. You're not the Blue Angels. It's not a flyby, right? Okay? So take that list down, condense it, and figure out where you can go ahead and then attack where the claim comes from. Customer transport fee. It's one of the first questions we ask. Hey, I'm sorry, did you jump in the tow truck and get there? No, I had somebody pick me up or an Uber or a Lyft. Okay, they still charge it. They charge it every time. I say when you take a $5,000 bill and you see those very large bills, or if you haven't, you might go into, we have, break that down. You know what I mean? Break that down to a couple. I've had a couple where they talk about like a winch fee. All they do is like basically put it on the, they don't even put it on a rollback. We're going to concentrate on just a couple of those out of the list, and that's how we're going to head and disprove where that fraudulent is. I think that's extremely important. Be on the lookout for it. Don't make the list because the lists are long. It takes a lot to get up for a $5,000 tow. And let me say this too. Sometimes this is a tow that's maybe like 20 miles. I mean, 20 miles. It's not really a bad tow, so it's not a bad accident. Okay, Uber and Lyft, I want to quantify this real quick. Yeah, Uber and Lyft are not involved to this, to our knowledge. So that's kind of a little bit of a disclaimer. We've gotten quite a bit of new referrals based off of the fact of recently leased vehicles. Insurance is gained, and then extremely real quickly, an Uber, very minor accident, rear end accident or something like that, where there's 4 or 5 people in the car. What makes all of them interesting is they go to about the 3 same urgent care, chiropractic care, physician centers. Shocking how all over the county you have a recently leased vehicle, okay, minor accident, multiple people in the car, all going to the same type facility trying to get care. That simply, folks, just doesn't happen unless there's some sort of commonality. I mean, where the counties we are in, we have 23 counties in the state of Maryland. I grew up in Carroll County. I can pretty much assure you, people that get into accidents in that county, all in the same type Uber, type Lyft type thing that recently got their insurances, aren't going to the exact same facilities every time. Think about it. People have accidents. The degree that they have is they're injured or they're not injured. They have a minor injury, maybe they're sore, maybe they need medics or in hospital. All of them can actually drive themselves to the center the next day. Sounds a lot like, a lot of jump-ins, not in the car, people not wanting to be in there, which is what we found in like staged accidents. But I do think it's one of those areas where you want to take a look at that and make sure that when you see an Uber or Lyft type case, again, not involving them, but you see a bunch of people in the car and you see more than one of them, start asking some questions. We go ahead and pull them out. We assign them to a specific investigator with our Office of Attorney General, and then we start monitoring those cases to make sure that they don't get out of hand. Unauthorized health plans. I'm sure we're going to talk about a lot this week about unauthorized health plans. When you think about being in an insurance agency, insurance administration, kind of a couple roles we fill, right? Level playing field for licensees, everybody's got to be the referee. Nobody wants to hear from them. You want to be anonymity, right? Be able to conduct business in your state, okay? And then consumer focus. Protect your consumer. Okay, unauthorized health plans. We have health plans that Marylanders are signing up with the insurance plans coming out of Puerto Rico and other territories and states. They're not ACA compliant. Eventually, what happens in any type of healthcare area is using different, which we talk about with improper marketing group, but you get to a point where you're going to get sick. You have COVID, you have flu, you break an arm or something like that. They're going in to get care. It's not ACA compliant, first of all. Secondly, the benefits that are promised, there's material misrepresentation, which is the two words I want you to take away from unauthorized health plans. They're behemoths. It's not an easy thing to investigate an unauthorized health plan. We're still trying to get our handle around it. We meet every 2 weeks just on this subject with a consortium of employees from regulation, conduct, all sorts of things, all the way to enforcement, trying to figure out how to best do that plan. How do we shut them down? We are starting to take some action on those because they really do. I mean, imagine, I always say that, put yourself in the position of one of your citizens of your state. They're feeling good about themselves, right? They get insurance. They feel like they're covered, okay? They get sick. And then when they get sick, which nobody wants to be, right? They all of a sudden figure out they don't have the coverage that they were promised. And if you want to talk about a vulnerable feeling, it's when you don't feel good and you feel like there's no support structure. And so these plans have left consumers basically out in the cold, and winter's right around the corner. We've seen these crop up, so we have a major focus on that. I have to think it's hitting, I always say fraud permeates a lot of different areas. When I was at FBI Miami, geez, a lot of fraud schemes started there. And they went out through this, the rest of the lower 49 and everywhere else. They kind of have to start somewhere, and then they spread out. Our goal here is just to make sure that everybody understands that kind of like what we're seeing, and that hopefully when you guys can take it back for you, it jogs a memory. Hey, somebody else is dealing with that. That's why with what Greg does and all the NAIC folks here, it gives us a forum to go ahead and share this intelligence. So you're not alone. And I think the gentleman today who spoke as the keynote speaker said that. It's not a position of our state versus this state. I called North Carolina DOI just a couple of weeks ago to run a couple of things by one of my colleagues down there. It's actually not a position of weakness. The gentleman was right. It's actually a position of strength. There's strength in numbers. And by all of you sitting here today, it's a lot of smart people. Together, we'll figure it out one way or the other. So you may have built a better mousetrap than even we have at MIA, and I'd love to hear about it. So just one of those things to keep top of mind. And let's see here. No drum roll. There is not, yeah. Number one, and I'll say this because, and I'm going to tell you the reason why I'm going to say it here in a second. It's still the reigning champ. Whether you're on the federal exchange or you're on the state-based exchange, we participate through our leadership has given us the ability to really reach out to other state and federal partners. Whether you're on the federal-based exchange, the state-based exchange, we have communications with Centers for Medicare and Medicaid Services, CMS, which ironically is actually based out of Baltimore. If you haven't known, Medicare sets the standard for healthcare in this country. Just does. It all, Medicaid is mostly federally funded, more than 50%. But Medicare is what's going to go ahead and drive the bus, even into your private insurances, your Medicare Advantage plans, things of that sort. If Medicare decides to cover something, okay, everybody else follows suit in some form or fashion. These right here, these are some of the top ones. I hate to say it, durable medical equipment. I worked a case, back in 2006. There's cases that are being regenerated, the traditional ones, and I'm not talking about diabetic texting supplies, incontinence supplies, the ones that are monthly billers. I'm talking about your traditional braces, your L1844 hinged knee braces, your L3720 elbows. They're coming back. They're buying information, and I'll tell you in a second where they're buying it from, and then they're billing in bust-out schemes. So you may get it hit through the exchange, Medicare, but it's going to flow down. It flows down everywhere. Lab testing is big. Wanted to talk a little bit about wound grafts. There's some local coverage determinations from Medicare. They're starting to pay for some cutting-edge wound care treatment for ulcers of diabetics. Little patches. Those patches are several $1,000s each and have to be done, reapplied over 6 weeks or so. Very high dollar codes. They're coming. You're going to see them. I can promise you that. It's when something starts to get paid out, it trickles down. That's one of those. It just came out. Telemedicine is still there. Mental health, there's a push, even by the Maryland Insurance Administration, as we should, to be able to get as much mental health counseling and services out to our citizens. Okay, with that, modifiers. How long was the session given? Who gave the session? Were they qualified? Was it billed appropriately by the level of expertise that they have? Okay, was it done in a telemedicine setting, or was it done in an in-person setting? Okay, same thing when you look at those codes. Was a procedure done in the office? Was the procedure done in a surgical center? Was the procedure done in a hospital setting? All three of those are going to have 3 different reimbursement rates. Okay, huge dollars. There's nothing like the American healthcare system. The amount of money that is poured in there just runs through the millions into the billions extremely quickly. Okay, and then pharmacy's in there too. Just take a look at that. If you haven't run into sober home and addiction treatment, you're going to, especially with the lab testing, things of that sort, urinalysis testing. Those are all high dollar figures. When we look at those cases, if we get one that's referred to us, one of the first things we look for is we'll want audit transactions of when they ran the test. what they were being provided, if they were they were providing methadone, and when did the doctor actually went ahead and then looked? How long after did they look at the test? You'd be surprised how many times somebody runs a multi-$1,000 lab test and actually never looks at the test. Okay? What's important from a public health standpoint is that's required. If they're using and you're prescribing methadone, okay, you're paying for both transactions. You're putting not us collectively, the folks that are perpetrating this are putting the patient at harm. You're almost double dipping. You're putting drugs on top of drugs, which can then lead to overdoses and or death. So it's one of those things that's public health and it's actually billing. So just keep that on your radar. I wanted to talk about this for a few minutes and appreciate Greg giving me the opportunity to talk about it for a couple of minutes. Back 10, 15 years ago, we had a corridor in Florida. It wasn't far from where I lived at the time in Boca Raton. It was called the Clint-Moore Corridor. There's a road that runs east and south of Southern Boulevard down there, which is the center of the county. It used to be like kind of the telemarketing capital of the world. There was actually a lead list company there that was run by Jordan Belfort, the Wolf of Wall Street. He actually ran a telemarketing center there. And so there was a lot of lead lists that came out of there. We conducted a couple of search warrants, made some arrests. They were doing it for diabetic supplies. Those lead lists now have become a lot more complicated. The information that is derived, and I'll explain to you where we're getting some general briefs, but I can read into it, is down from the dark web. I would submit to you that if I was able to, and I can't now, but if I asked the Bureau, run Sean O'Neill, you know, he was born in New Jersey, lived in Maryland, you know, is a CPA. Give me his PII and PHI. Tell me his last 5 addresses, and tell him, give me his driver's license. And I'd also like to know his insurance card. I bet you probably in, I don't know, less than 5 minutes, all that information is going to appear. All of that stuff is for sale. They will sell those in lead lists today anywhere between $2 and $10. That's where a lot of those new little DME bust-out scams are coming from. All of that information has been obtained, and the root cause of that is because there's a lot of data breaches out there. Data breaches that don't make the news. And I'm here to tell you from experience that most major companies, when they incur a data breach, will they ask for FBI's help? They will. But most of them don't want to. Simple reason, it's very bad publicity. Okay? All that information's out there, all of that information's being traded. Okay, so keep that in mind as to where those lists are coming from. If you see commonalities, we always try to put things together, connect the dots. Actually, we just put some new pins in to get some intelligence analysts, and we're hoping that comes through because we're going to run some higher data analytics to kind of to flow chart it. I just wanted to put that on everybody's radar and stuff. I've got about 5 minutes left, but I want to talk. This is kind of funny. I've kept this in here for the last year, right? Hey, AI, right? It's on the horizon. No, it's not. The horse is out the barn. It's running. It's like one of those Budweiser commercials, like he hooked up to the beer cart and he's sprinting away from you, okay? Always remember this, and if I can leave you with something, it'll be this in the next slide. If we as an industry are using AI, so are people that have nefarious intentions. Don't think that they will not use technology for their benefit. There are many of people that I've had to put in prison that were rightfully should have gone to prison, that if they were brilliant minds, and if they would have just applied themselves in the right way, they wouldn't have been in prison. They would have been entrepreneurs and made a lot of money. They will use AI just as much as we will, okay? So always remember AI cuts both ways. The takeaway here today, there's a few things, okay? As an agency, and we're starting to do this, it's continual training, okay? I don't even know if it's annual training. We think it's every 6 months training. Things move that fast. Where do you get the information to be able to train? I'll switch around to like the last one here real quick. Liaison partners are your friend. They really are. Next week, myself, Rob, a bunch of other MIA folks, we're heading over to FBI Baltimore for their corruption fraud working group. These are around the country. This encompasses Maryland and Delaware. It's next Wednesday, I think. They're going to go in there and share intelligence. You're going to see people that may need that you could use to help you with your agency. It's an invaluable 2 hours. It's a 2-hour commitment, okay, to go in there and do that. Task force resources, you might be looking at the same people. You'd be surprised. If you want to reach out to me, I will hook you up with your local task force. Whatever state you're in, your area of responsibility, I will make sure that I find out if there's one there, and if there's one there, I'll go ahead and do an introduction for you. We call it here is, secondly, is our flexibility of movement, okay, no matter what it is, life and health, okay, property and casualty, title, okay, the flexibility to move resources. A lot of times we get siloed. We've got 3 investigators and each one. Can't operate like that anymore. Fraud doesn't operate like that anymore. And then lastly, embrace the technology. We're going through a big technology upgrade here in Maryland. We're putting in a new case management system, and we're hoping that case management system allows us to see trends that we can go ahead and start sharing both regionally and then through Greg, the NAIC nationally. Because as we all know, okay, something that hits Maryland, I can assuredly tells you hits Pennsylvania, hits Virginia, hits West Virginia. They drive over the line. There's a small town in Western Maryland called McHenry. You can go in about 3 different directions in about 10 miles. You can be from West Virginia and Maryland and Pennsylvania. Most of your bank robberies are there. There's like 4 major highways in 3 states, okay? Same thing is true with insurance fraud. It'll go from one state to the other state to the next state. If we're all sitting here, I can guarantee you some cases that the MIA has right now are sitting on your doorstep. It may be more pervasive because it's on our front right now, but it is still sitting in your lap too. And it's our job to be able to work with you. And that's what we really, I mean, that's our goal, is to work across state lines, to be able to share that intelligence, to be able to share our expertise, and to collaborate. And so, again, my time's almost up. I will be at the social tonight. I'll be here afterwards. So I look forward to meeting you and all the other MIA folks here. And I always leave things, because my grandfather's not here anymore, but I think it's pertinent. My grandfather, who served in World War II, and he was a farmer, always said to me, the greatest gift that you can ever give anybody is your time. And so, because it shows respect and that you mean something to the other person. So I thank you for your time today. Appreciate you.
Thank you, Sean. Thank you, everyone, for joining us. That will take care of this session today. I guess we do have 2 minutes.
Oh,
to take questions.
Look at that.
So, okay. I was going to say, I thought maybe we had some questions, but never mind. We're good to go. So thank you all for joining us today, and enjoy your next session.